Question 11. You're caring for Beth, who underwent a Billroth 2 procedure, surgical removal of the pylorus and duodenum, for treatment of a peptic ulcer. Which findings suggest that the patient is developing dumping syndrome, a complication associated with this procedure? A. Flushed, dry skin. B. Headache and bradycardia. C. Dizziness and sweating. D. Dyspnea and chest pain. Question 11. Answer: C. Dizziness and sweating. Question 11. Explanation: After a Billroth 2 procedure, a large amount of hypertonic fluid enters the intestine. This causes extracellular fluid to move rapidly into the bowel, reducing circulating blood volume and producing vasomotor symptoms. Vasomotor symptoms produced by dumping syndrome include dizziness and sweating, tachycardia, syncope, pallor, and palpitations. Question 12. You're developing the plan of care for a patient experiencing dumping syndrome after a Billroth 2 procedure. Which dietary instructions do you include? A. Omit fluids with meals. B. Increase carbohydrate intake. C. Decrease protein intake. D. Decrease fat intake. Question 12. Answer: A. Omit fluids with meals. Question 12. Explanation: Gastric emptying time can be delayed by omitting fluids from your patient's meal. A diet low in carbs and high in fat and protein is recommended to treat dumping syndrome. Question 13. You're caring for Louis, a 67 years old patient with liver cirrhosis who developed ascites and requires paracentesis. Relief of which symptom indicated that the paracentesis was effective? A. Pruritus. B. Dyspnea. C. Jaundice. D. Peripheral neuropathy. Question 13. Answer: B. Dyspnea. Question 13. Explanation: Ascites puts pressure on the diaphragm. Paracentesis is done to remove fluid and reducing pressure on the diaphragm. The goal is to improve the patient's breathing. The others are signs of cirrhosis that aren't relieved by paracentesis. Question 14. You're caring for Jane, a 57 years old patient with liver cirrhosis who developed ascites and requires paracentesis. Before her paracentesis, you instruct her to A. Empty her bladder. B. Lie supine in bed. C. Remain NPO for 4 hours. D. Clean her bowels with an enema. Question 14. Answer: A. Empty her bladder. Question 14. Explanation: A full bladder can interfere with paracentesis and be punctured inadvertently. Question 15. After abdominal surgery, your patient has a severe coughing episode that causes wound evisceration. In addition to calling the doctor, which intervention is most appropriate? A. Irrigate the wound and organs with betadine. B. Cover the wound with a saline-soaked sterile dressing. C. Apply a dry sterile dressing and binder. D. Push the organs back and cover with moist sterile dressings. Question 15. Answer: B. Cover the wound with a saline-soaked sterile dressing. Question 15. Explanation: Cover the organs with a sterile, non-adherent dressing moistened with normal saline. Do this to prevent infection and to keep the organs from drying out. Question 16. You're caring for Betty with liver cirrhosis. Which of the following assessment findings leads you to suspect hepatic encephalopathy in her? A. Ascites. B. Kvostek's sign. C. Trousseau's sign. D. Hepatojugular reflex. Question 16. Answer: Ascites. Question 16. Explanation: Ascites is an early neurologic sign of hepatic encephalopathy elicited by asking the patient to hold her arms stretched out. Ascites is present if the hands rapidly extend and flex. Question 17. You are developing a care plan on Sally, a 67 years old patient with hepatic encephalopathy. Which of the following do you include? A. Administering a lactulose enema as ordered. B. Encouraging a protein-rich diet. C. Administering sedatives, as necessary. D. Encouraging ambulation at least 4 times a day. Question 17. Answer: Administering a lactulose enema as ordered. Question 17. Explanation: You may administer the laxative lactulose to reduce ammonia levels in the colon. Question 18. You have a patient with achalasia, incomplete muscle relaxation of the GI tract. especially sphincter muscles. Which medications do you anticipate to administer? A. Isosorbide dinitrate, Isortil. B. Digoxin, Linoxin. C. Captopril, Capoten. D. Propranolol, Indoril. Question 18 Answer, A. Isosorbide dinitrate, Isortil. Question 18 Explanation, Achalasia is characterized by incomplete relaxation of the lay, dilation of the lower esophagus, and a lack of esophageal peristalsis. Because nitrates relax the lower esophageal sphincter, expect to give Isortil orally or sublingually. Question 19. The student nurse is preparing a teaching care plan to help improve nutrition in a patient with achalasia. You include which of the following? A. Swallow foods while leaning forward. B. Omit fluids at meal times. C. Eat meals sitting upright. D. Avoid soft and semi-soft foods. Question 19 Answer, C. Eat meals sitting upright. Question 19 Explanation, eating in the upright position aids in emptying the esophagus. Doing the opposite of the other three also may be helpful. Question 20, Brittany, a 20 years old student is admitted with acute pancreatitis. Which laboratory findings do you expect to be abnormal for this patient? A. Serum creatinine and BUN. B. Alanine aminotransferase, ALT, and aspartate aminotransferase, AST. C. Serum amylase and lipase. D. Cardiac enzymes. Question 20 Answer, C. Serum amylase and lipase. Question 20 Explanation, pancreatitis involves activation of pancreatic enzymes, such as amylase and lipase. These levels are elevated in a patient with acute pancreatitis.